Hi everyone, my name is tigisttamrat. I am interning at MedstarFranklinSquareMedicalCenter in the Family Health Center, and I am part of the care coordination team. So your preceptor will ask you to choose between two sets of hours. You have 8 a.m. and 4 p.m. and 9 a.m. to 5 p.m. I chose 9 a.m. to 5 p.m. On some occasions, like meetings or if you have retreats, you might be asked to come in at 8 a.m., but you are usually not required to work after 5 or on weekends. Sometimes I stay longer than 5. There are patients I still need to work with or immediate tasks that I need to finish. And I rarely check anything on the weekends, but if I want to see updates on medical records, I check on my laptop at home, but I've only done that a handful of times because of urgent matters with patients. One of the main reasons I chose my internship site was because I really wanted some patient interaction and in my experience. And since I have interest in going into the medical field, I really wanted to get a better understanding of what the patient and healthcare provider relationship was like. And I also wanted to have an opportunity to work closely with doctors, social workers, nurses, and other medical professionals. And I also had interest with working with patients with chronic diseases like heart failure, renal failure, pulmonary disease, and etc. I also wanted an in-person internship for an enhanced experience. My internship was supposed to be in person from the beginning, but a week or so prior to starting date, I was told it would have to be virtual because of COVID, and I had to adjust to working from home, and I got access to all of the material on my computer. But afterwards, the team expressed to me that they were going to work on getting me to come in person because it just makes the experience a lot better. So after a month of virtual work, I finally started being an in-person intern. And given that I'm an aspiring physician, I really wanted to um, get an internship site that would enable me to have some patient interaction as well and work closely with doctors. And after looking through the information from my site, I believe that it would be the best one to give me those opportunities. And I have learned a lot about the various barriers to healthcare and how it can impact patients' health in a very negative way. And being able to work with doctors, nurses, social workers, and everyone else on my team has really opened my eyes, and it really helps me understand that making sure that these types of needs are met is really, really important. And it's just helping me get an overall understanding. Some things you should consider when choosing your site is distance. If it is whether you live on campus or you live at home, you have to see how far it might take you to, sorry. You have to see how far it might take you to get there, and depending on, traffic, what time you start, what time you would end, and all of that. So keep that under consideration. And also see if your skills align with your objectives. Not saying that if they don't, you shouldn't apply or you shouldn't even go in, but just to say that you should see if that would be of your interest, and also think if it will help you get skills and knowledge for your specific future career goals, if you have any. But these are just some things that you should consider when going into, choosing your internship site. So one of the projects I'm working on, we have two projects, and one of them is a how to use an inhaler poster with, simple directions on how to use an inhaler properly. And this is really useful for patients with asthma and COPD, which is chronic obstructive pulmonary disease, and a very large number of our patients actually has these conditions, and it's very hard for them to breathe on their own, so they have to use different techniques to help them breathe better, and then inhaler is one of the most important techniques to help them with this problem. And I'm also working on an infographic on smoking and its correlation to COPD. We have a lot of patients who either smoked in the past or are still current smokers, and it would be interesting to see what they know and how they managed to quit if they did, and if they are managing or even thinking about quitting. I believe my inhaler project is really important because These directions really enable patients to use them correctly, and that can really alter their breathing and alter their day-to-day lives because sometimes they have to use oxygen tanks with cords up in their noses, and it's very hard to breathe properly, and that can be very uncomfortable. And they just want to be able to breathe freely. So hopefully it'll help them get a better understanding of how the small but very important details that they have to look at when using an inhaler will really make a difference for them. There are a lot of pros in contrast to cons. I'm really actually enjoying my internship site. I'm very happy here. Everybody is really amazing, and I'm learning a lot of things, and I'm getting an amazing experience. I'm building connections with a lot of doctors and nurses, medical assistants, and this helps me expand my network. And I'm also getting a lot of knowledge on various topics in healthcare, not just clinical, but also, psychological, mental, social, financial. And you never know when you might get an opportunity to receive an offer after graduation. I know some people have. And I can also get clinical experience. I can shadow doctors, which will give me some more insight on how doctors operate and how they treat patients well. And also, I really love the fact that I can form relationships with my patients. I really love all of my patients, and I really love working with them and being there for them. And of course, this is going to be an amazing addition to your resume. And it's really going to help you just build your confidence. The main disadvantage of the internship is the fact that it's unpaid, and this can be a very problematic thing for a lot of people because not only is it full time, like a 9 to 5, but you also really are not able to take classes or even work because it is full time. And I've thought about working on weekends, but sometimes you just have to prioritize what you have to do first. So I think that's the only con about the internship. So one of the things that I learned at Towson that I've actually been using is a genogram. I'm not sure if the curriculum has changed, but for mine, we had to take Bio 191 and we learned how to look over genograms and make them and all of the information for that. And actually, might be asked to make a genogram for some of the patients. I know I have, and I know the person before me has as well. It's really just an explanation of the patient's family tree and who it's composed of and how close they are. We have patients that do not have anyone, so you really get to see what their life is like. Also, another course that really helped me is anatomy and physiology. I took 1 and 2, and we did go over all of the organ systems. So, in regards to COPD, heart failure, kidney disease, and all of that, it was really interesting correlating what I learned and how these conditions actually occur in the human body. We also learned how to do needs assessments in the 400 level classes and also 315, and these help with your research and your projects. And public health also really helps me understand the barriers to healthcare. And, this can be financial, like not having money for transportation, or even social, not having good support system, psychological, not being motivated, and etc. One of the things I wish I would have learned is a deeper understanding of medical insurance types and what they entail, especially because this just really affects what kind of care the patient will get and how someone's financial situation can prevent them from getting care. This, goes with the medical insurance type. And I think it's a very important thing to learn because it really does affect people's access to care and also how important social workers are in healthcare. I really don't think people focus on the role that they have, and it's really just an amazing task. They have a very great deal of responsibility and they really do a lot for the medical community. So, as you go into your 400 level courses, I really encourage you to ask questions. Don't be afraid to make mistakes. That's how we all learn. Work with your friends, your students, your professors, go to office hours. Don't forget to relax. Don't get too overwhelmed. Find coping mechanisms that will help you get rid of the stress or even decrease it. Try to finish your required assignments as early as possible so you do not get stressed. Try to do small portions at a time. And I know it's hard and I know we'll procrastinate, but it'll help you in the long run. And make sure you're following up with your advisor to check your course requirements. You really want to make sure that you are on the right track. You don't want any delays for graduation or your internship. And most importantly, keep going. You're almost there. I'm very happy for you, and I can't wait for you to see what the internships are about.